Hi, this is Dr. Ravindra Mehta, the Chief of Chest Medicine and ICU Medicine at Apollo Hospitals in Jayanagar, Bangalore. And today we're going to talk of something which has shaken us tremendously in the second wave of COVID. What we're talking about is the Delta variant of COVID-19, also described as the Indian variant. And it's what is it exactly? Its repercussions and what can we do about it? So what is this Delta variant? Well, we know that last year the UK started to describe variants of COVID-19, which means that the virus was starting to mutate. For those of us who are surprised, it is not unusual. Viruses like influenza have been mutating or changing. Mutation is a word, scientific word for changing. So the COVID-19 virus, just like other viruses in the history of viral medicine, was starting to change. This term is called mutant, and UK started to look at the mutants more carefully than anything else. In the December second wave in the UK, they had a mutant which was called the UK variant 117, and that was responsible for the rapid infectivity and the inundation of UK healthcare. India started to study these variants a little later by a consortium, and now we know that there are variants in India. So with this background, let's understand this particular Delta variant. So in April, this variant was discovered and the WHO called it a variant of interest, and by May we knew that it was highly infective, so it became promoted to a variant of concern. So what is this exactly? It is technically called 1617.2. It is a mutation of the COVID virus where it is highly infective. Kindly note the words highly infective, but not necessarily more lethal. It does not kill more, it just spreads more. And because of that, we believe that it spread very rampantly, and that is why we had a very steep rise of this COVID second wave, and it has fallen down also proportionately as most people got infected. What can we do about it? Once we understand, we must understand two things: that COVID-19 will keep mutating, so we have to be very cautious, and at one level, if we take precautions, we shouldn't be able to escape any of these variants. Two, we must understand that it's highly infective. So like the last time when we were taking chances, we should not. It is spread by something called aerosol. So whenever you enter a room where there's somebody else, you must make sure that you're appropriately masked, and social distancing may or may not matter because it's in the air. But you must make sure you have your mask on. Secondly, when you travel also, whether you travel in a small vehicle or you travel in a plane, you must make sure you have a mask on because it could be there around you. So this is the precautions to be taken when it comes to the Delta variant. Do we have all the answers? No. But we understand that it's highly infective, so we have to take all these precautions. What else do we have in the armamentarium of protection? There's vaccination. We know that the vaccines are also carefully looking at every one of these variants of concern. And we know that every vaccine, whether it's Covishield, Covaxin, Sputnik and all the others, are going back to the lab, trying to figure out whether the vaccines work against this. And the variable reports of a good amount of success of the Indian vaccines, but more information is required. So for now, let's understand that COVID-19 is going to mutate. The Delta variant is a variant of concern which is known to be highly infective. We believe that it was probably one of the main causes of this rapid second wave. We also know that it's present in the aerosols, so we have to be quite careful. And we must maintain the culture of masking wherever we go. And vaccination, we will know more and more, but we must vaccinate currently as much as possible, with no choice between the vaccines at this point because we don't know enough. But we believe that the vaccine manufacturers and what is there at this point is going to be reasonably successful against this particular variant. So more and more information in the COVID pandemic. Let's keep an eye on this space as information comes out. This is what we know at this point. Together, using these precautions and these understanding, we can surmount the COVID pandemic. Thank you.